and giving me the opportunity to present this topic, which I became very passionate about since 2019, fortunately or unfortunately. Fortunately, because I had the opportunity to learn a bit more about this through conferences and the articles that published in the literature. But unfortunately, that I still think it was too late. Again, thank you, Camberwell Grammar School, for starting this, because the e-cigarette making companies started attacking our youth people and teenagers. So we should have an informed session to basically tackle that approach. So I would like to start with an introduction, saying that what I'm going to hopefully cover in this presentation. Firstly, how does the e-cigarettes device operate? Are they good in smoke cessation? What is the literature about it? Why e-cigarettes are becoming popular, very popular these days, and how can teenagers buy them or access them? Are the flavors attractive to young people or never smokers? And that's one of the reasons that become interested. How is the initial exposure to e-cigarettes? Is it like pleasurable or like horrible, like normal tobacco smoking? Can this lead to recurrence of tobacco use, like when it started about 100 years ago? Is it an occasional use, or if a young person starts using e-cigarettes, they like to keep using it, and whether it is a gateway for addiction to other agents? So my story started by when I was a lung specialist in 2013. This cartoon was my understanding about e-cigarettes. So they've been around for about 20 years, but up to 2013, this was published in a very reputable respiratory journal that I was like receiving the hard copies every month. And this lady is starting using e-cigarette, and the guy who is a smoker tells her that who knows what kind of toxic chemical vapor you are inhaling with those e-cigarettes. I prefer to use my carcinogen that I know and I'm comfortable with. And I went to a conference in 2019 and I learned a lot, and I came back home and I said, look, my son at the time was year 9, and I said, look, let's have a talk about this. I told him about e-cigarettes, what they are, and I was waiting for his response, but he told me he already knew about it. He heard it at some other social media and spoken to some of the other friends throughout gatherings and so on. He had more information than e-cigarettes well before a respiratory specialist knows about them, and it was embarrassing. Since then, I went and educated a lot of GPs, talked to them, and I thought it was probably only me who didn't have enough information. But then I realized that in our health profession, there are so many doctors, general practitioners, even respiratory physicians who actually don't know much about this. So I thought there is really something wrong that has to be dealt with. So I started by reading a little bit and accumulating a bit of literature about it. I found this article published in a very reputable respiratory journal in 2011. They explain a little bit about e-cigarettes and cigarettes in total, and they believe that cigarettes typically contain 1 to 2 milligrams of nicotine. The lethal dose for a child is only 10 milligrams. And one cigarette or 10 cigarettes is equivalent to that lethal dose, and a packet of cigarettes basically has 20 milligrams. It's good to know that cigarettes are the most addictive drug of abuse, even more than cocaine and heroin and so on. And in terms of reported difficulty of giving up, cigarettes are by far at the top of the line. So being addicted to that at a young age would become a very serious challenge in the future. But the fact is that we are doing really well in terms of giving up smoking. Australia has led the world in implementation of tobacco control by all changing the packets, and also restriction of where people can smoke and so on. And that has been quite successful to reduce the rate of smoking from 27% in 1995 to only 14%. And in particular, younger people do really well, like 16 to 17 years old, from 30% in 1999 to a third of that in 2014. And even in younger people, from 15% reduced to only 3% in that sort of time period. So you can see that it works, and it actually works a lot better in young people. And that's probably one of the reasons that these e-cigarette companies are now attacking the younger people. How does the device operate, and what are the different components? So again, based on that article that explains about how these devices operate, they have 3 different compartments. One is a rechargeable battery, another one is a flow trigger that then allow the air flow through a heating element. That heating element can warm up the air going through that, and also the cartridge that is containing nicotine and a medium oil, which is usually propylene glycol. The air that is going through that element warm up, and then the air moisture is aerosolized, and the water vapor that accumulates in the mouth when the person exhales that produces a big fog. And all the nicotine and flavorings and other additives and contaminants that are carried in the aerosol, they are all going into the mouth, and the person inhales it into the lung, whatever is in the nicotine containing cartridge. And I'm going to tell a bit more about the problems that they can generate. So people can buy 3 different products. You can buy the whole delivery device, you can buy the cartridge alone, or you can buy a refill solution. One cartridge contains up to 20 milligrams of nicotine, which is a packet of a cigarette. But you can buy a refill kit that has 1,000 milligrams of nicotine, like 1,000 cigarettes, so you can fill the cartridge with. And then when you have the syringe and the cartridge, you can just put as much as you want, and there is no control over it. The propylene glycol, that is the media that is delivering this nicotine, the manufacturer says that it's been used in all the food packaging and all the food markets. They say that it is safe, but it is safe probably in the package, not when you inhale it. Who knows? When you heat up the propylene glycol to 200 degrees and you missed it and you inhale it, what's going to happen in your lung? And also the long-term side effects of that. We're using e-cigarettes for a decade. What's going to happen in 50 years' time? In addition to that, young people or other people can go on YouTube and see how you can actually fill this cartridge with a lot of other things, like marijuana and so many different products that you can fill up the cartridge. Basically, your device can be a very good delivery mode for all different drugs. I would like to show you the e-cigarette effect in smoke cessation, because this is how these machines came to the market. Initially, everybody says these are good for smoke cessation. By making e-cigarettes, we're actually helping people to give up smoking, and we are doing good to them. The best trial that I would refer to is this one that was done in England, published 2019, again in one of the most reputable journals. They had adults who were trying to give up smoking by attending these 4 weeks stop cessation services. They were randomized to 2 groups of given nicotine replacement therapies that are available in the market, or given e-cigarette to them. The e-cigarette group were given a starter pack with 30 ml bottle of tobacco royal flavor e-liquid, which at a concentration of 18 milligram per milliliter. Basically, this covers them for about a month. Like that would be like 30 packs of cigarettes. And they were asked to then purchase their own e-liquid online or from local vape shop. And the original cost of the kit was about $40. So after 1 year, the abstinence rate was 18% in the e-cigarette group and 10% in nicotine replacement group. So you can see that people who were smoking e-cigarettes to give up smoking were more successful than people who have nicotine replacement therapy. And in conclusion, we say that that was more effective. So that was what we believed at that time. But then we actually went and looked at a bit more in detail of what actually happened into those patients and further follow up. Then we can see that among participants who managed to be like cigarette free at 1 year, 80% of them were still using e-cigarettes. But in the group that were using nicotine replacement therapy, only 9% of them were still using nicotine replacement. So basically, what you have done in this very good article, which was produced by reputable people, you just changed an addiction to another addiction. 80% of people who were smoking, they're not smoking, but they're doing e-cigarettes. And the other thing was, the more important thing was that 30% of the smokers in the e-cigarette arm, so they went through e-cigarettes and they were not successful to give up smoking. 30% of them were doing both. So both e-cigarettes and smoking. So basically you are changing one addiction to two addiction in a third of people who went through the trial. That is more important than the conclusion. So treatment with nicotine replacement therapy achieves abstinence rates of 20% at 1 year. And if patients use combination of nicotine replacement therapy, the success rate is even higher. And that's very good in our sort of field. Although 100% is ideal, but 20% reduction with nicotine replacement therapy is good. So this evidence of effectiveness that I mentioned in that trial, which is, let's say, double than nicotine replacement therapy, should be weighed against the short-term and also long-term effects of e-cigarettes on general health. E-cigarette vapor contain many toxins and exert adverse biologic events. Some of them are proven. These are against accepting the transition from tobacco smoking to indefinite e-cigarettes. And the other important thing is that if an adult is using e-cigarette to give up smoking, there are a lot of effects on the children trying to follow the same rule. It becomes a norm. And if they go to school and one of the friends says, look, just try this e-cigarettes, they're already exposed to that. They know about it. And that makes addiction a bit easier. And also there is a exposure of the children to e-cigarette vapor is causing like passive smoking effects. So some people didn't know that inhaling the e-cigarette has the same effect of being a passive smoker. And we all know that if the youth start e-cigarettes, they become smokers a lot easier than if they did not. Also, not having regulation and having uncertainty around these products was quite worrying. And in particular, we know that if you really wanted to use e-cigarettes to give up smoking, there is a lot of other ways that you can do it, which are safe and effective. Why don't we use them? So the fact is that Philip Morris, which is the biggest cigarette making company, bought 35% of the biggest e-cigarette making company, $13 billion. Because they know that cigarette smoking is declining and this move allows them to stay in the nicotine business, Philip Morris has no interest in reducing the number of people who smoke cigarettes. Obviously, they want to sell cigarettes, and probably this is a fail-safe for them to continue being in the business. Juul, which is a very attractive e-cigarette device, is like a USB device and has quickly reshaped the market since it became available 7 years ago. The profit surged by 600% only in 1 year. But it produces a lot of risks to people, in particular this device, because it has a very high level of nicotine. One cartridge of that contains about 20 cigarettes, and some teenagers go through 3 of them in a day. Because it uses nicotine salt allows people to inhale a high level of nicotine without having the local irritation that is associated with cigarette smoking. So that's why they can inhale like 3 packs of cigarette without being uncomfortable. It makes it easier to initiate nicotine use, and also it is easier to progress to nicotine dependence. But the problem is that to be able to sell these devices in some countries like Australia, some of the companies just do not declare that this device has nicotine in them. Hence, about the majority or 2/3 of young people who start inhaling Juul don't actually know that there is nicotine in it. They